Welcome to the Sound of Ideas from IdeaStream Public Media. I'm Stephanie Haney. Thank you for being with us. Loneliness and social isolation have been recognized as major public health concerns by the World Health Organization. For some, the effects can be fatal. The WHO reports that worldwide about 100 deaths per hour can be attributed to health outcomes associated with loneliness. It's a problem that spans generations. Over the last few weeks, we've been exploring the importance of connection across different niches. During one of those conversations, Jim in Maslin emailed us to say, the danger point for most people is after the working life, when work-related friendships go away. That is, late 50s to mid-60s and beyond. Some of those working years may be extending a bit later, but we do take your point, Jim, and we appreciate you mentioning it. In fact, experts back up that idea, saying that lack of social connection can take an especially serious toll on physical and mental health for people over the age of 65, which is a population that's growing rapidly in the U.S. While many of us experienced strained social ties during the COVID-19 pandemic that have been difficult to rebuild, for some seniors, disabilities, financial constraints, and the digital divide have made reconnecting or connecting in the first place even harder. So today, we're focusing on creating community for people in their late 50s and beyond. Our guests today represent social groups around Northeast Ohio that are working to help older adults build those social networks. With me for the conversation, we have Denitra Brown, the director of iConnect at the Greater Cleveland Neighborhood Centers Association. Denitra, thanks for being here.
Thanks for having me.
We also have with us Dr. Amanda Lathia, Division Chief of Geriatrics and Palliative Care at University Hospitals Cleveland Medical Center. Dr. Lathia, thanks for being here.
Of course, thank you for having me.
Also with us, we have Eleanor Bergholz, Ellie, author of When Knitting Becomes Nurture. Ellie, welcome. And we also have Terry Vakes-Norris, volunteer with Lake County Phone Pals. Welcome to the show.
Thank you.
If you want to be a part of this conversation, give us a call. You can do that at 866-578-0903. Maybe you have a story about rebuilding connection, or maybe you have a question about the impact of loneliness and social isolation. Whatever it might be, you can also email us at soi@ideastream.org, or you can message us on Instagram at The Sound of Ideas. Now, we'll start with Dr. Lathia so we can define what we're speaking about today. Dr. Lathia, what's the difference between loneliness and social isolation, and why does that distinction matter?
That's a very good question. So, being socially isolated is an objective idea of not being near to other individuals and family members. Someone can be socially isolated but not lonely. Loneliness is a subjective feeling of it's a distressing emotion from the perception of an inadequate social relationships.
Okay, so it's like a yearning, a wanting for a social relationship that's not existing.
Yes, it's how one perceives their. It's a difference between the desired relationships and what actually exists.
Okay, and how do you differentiate loneliness from depression, Dr. Lathia?
That's also a very good question. So you can be lonely and not be truly what we would call in the medical field of clinically depressed. Loneliness can lead to depression. Clinical depression is a state of when you're feeling down, life is not worth living, and feeling hopeless and worthless, and those symptoms last for a significant period of time. You can feel lonely without being clinically depressed, but loneliness does increase the risk factors, increase risk for developing depression or worsening depression. And people who have a history of mental illness are at greater risk of feeling lonely.
Okay. Let's talk about the greater risk for older adults. In your medical experience, can you tell us what are some of the unique circumstances that might make loneliness and isolation more likely and more of a difficult problem for older adults?
Absolutely. So, as would make sense, living alone, not having a partner, so being single, also having been widowed, or losing a spouse or a significant other increases risk of being lonely. Then also there are other risk factors, especially in older adults. Being female increases risk, lower educational level and socioeconomic status, and then also having multiple chronic medical conditions, which is common in older adults, and those who are functionally dependent on others. So having difficulty with your daily activities increases risk for loneliness.
Let's learn about one of the programs that are available for older adults to make connection and for adults in general to make connection. Terry, can you tell us about the Phone Pals program and how that works? And I also want to ask you if you're comfortable sharing your age and the age of the participants.
Okay, I'm 77, and the age of the participant, I believe she's 86, pretty sure, right? 84, 86.
This is one particular participant
Oh, yeah.
that we will get to know in just a moment. But in
Yes.
general, yeah.
Sorry.
That's okay.
Sorry about that.
That's okay.
Anyway.
You know where we're going.
Yeah, okay. So, and I started, I was with the RSVP at that time program, volunteering for seniors that want to volunteer. And this program was one of the options. And I thought, well, I'd like that. I had done that a long time ago to check on senior every day to make sure they were still alive and well. That was a long time ago. So I thought, well, I'd like to do this. So at first I had a couple of people, but sometimes they're not really interested in the program. They develop relationships outside of the program, and they're able to do fine without it. And then it started during COVID, and so that was a perfect time for isolation. So,
So what is RSVP? You mentioned that.
It's a volunteer program in Lake County, and
Okay.
I can't honestly tell you what it. And now it's not even the same name anymore. Names are not my forte.
Okay.
But it's they send you emails every month and see if you're interested in volunteering for anything. So there's no obligation. So it's really nice. You can say, and some things are every week, like Meals on Wheels. Some things are volunteer to be a patient, like I would do this, volunteer to be a patient for brand new nurses that never got to have that opportunity. So you can just join and have there's like maybe 10 opportunities that come up in a month, and you could take none of them or 10 of them, and nobody looks down on you one way or the other.
And it's a
really nice.
variety of different volunteer
yeah.
opportunities, and
All
one
sorts.
of them is the Phone Pals program.
Yes, exactly.
Okay. And the Phone Pals program is a program that connects people that want to make connections over the phone.
Yes, yes. And it's somebody who feels isolated to one degree or another. You know, maybe they have family, but they're not communicating with them that much or whatever. In some capacity, they need someone to be there to call them.
So you had a lot of options, it sounds like, to
Yes.
volunteer your time. What
Yes.
was it about the Phone Pals program that resonated with you?
Well, I don't only do that one, but that one, I don't know, just because I had done it before and I really enjoyed knowing that I might help somebody feel safer knowing that I was there.
Okay. And one of your phone pals, which you mentioned, is Kathy. How
Yes.
long have you been partnered with Kathy?
Since COVID, so it's been about 6 years now.
It is wild to believe that COVID was 6 years ago.
I know.
Isn't it? Okay. So we are here now. We are post-COVID. We'd like to talk to Kathy now. Kathy Fury, welcome to the Sound of Ideas. You're a participant with Lake County Phone Pals. I'm Stephanie Haney, the host of the show. Thank you so much for calling in, Kathy.
You're welcome.
Kathy, if you don't mind sharing, can you tell us how old were you when you joined the Phone Pal program?
Well, I'm doing the math here. I didn't realize it's already 6 years, but let's see. I was probably 78.
Okay, so that would make you 84 now, is that right?
Well, in September.
Okay, well, happy early birthday coming up in September. How did you find the Phone Pals program, Kathy?
I didn't search for it. Lake County called me and asked me would I participate. And at that particular time, I was isolated. And I said, yeah, absolutely, I'd love to try. But I didn't have much hope. I really didn't in any one of the programs they have for older people. I just thought, oh, it's quirky. Nobody will ever get back to me. Who knows? They'll never pair me up with someone that I would like. and they did a great job. I love Terry.
Thank you, Kathy.
I mean, I mean, they couldn't have paired me up with someone more perfect. We were colleagues at one time, but we never met.
Oh my gosh!
She
Wow.
was, well, I was a makeup artist, but she was a whole different area of that business, and so we never came together. But she knew everybody I knew. I mean, it was amazing. I just adored her from day one.
It's wonderful that you were able to make that connection. Kathy, I'd like to ask you about some of the ways that you stay connected with other people in your life, maybe other family or friends. How are you managing that?
Well, I have family. I love them. I adore them. They're the reason I get up in the morning, but they're all younger than me. My older family, my core family, this brick and mortar of who I started out life with, they're all gone. And so when you're dealing with children, grandchildren, great-grandchildren, they still look at you as the one that needs to be in control, that you're their mortar. And so they don't want to hear anything that might be slipping with me. And that's difficult because I have to accept those things.
Can you tell us a little bit about your situation? Is there anything particular about your condition, maybe your health, or anything about your social preferences that makes it more challenging for you to connect with people at this time?
Well, I do have agoraphobia, and I don't know if and PTSD. So I really don't know how many of your listeners understand what that is. And so it really is difficult for me to get out of my home. But I still try to go to the grocery store. I have to eat. And if I have to go somewhere, if I absolutely have to, then I go. But it's not an easy process. And just having Terry call me once a week has been very helpful just to give me strength. I don't know how else to explain that. But she's someone I can open up and be me with and talk openly. And she's been very helpful.
Thank you for sharing that with us, Kathy. And Dr. Lathia, can you please explain for people who may not be aware what agoraphobia is?
Oh, absolutely. So agoraphobia is a fear of being in public places and being around other people. And I really just want to applaud Kathy for her honesty and willing to share with everyone her experiences and what she's going through, and it makes me so happy to hear and touch just to hear about this program and how a simple thing as talking on the phone once a week with somebody can really provide comfort and help someone to feel less isolated.
Kathy, can you tell us how being a part of the Phone Pals program has impacted your life, maybe improved it?
Well, I look forward to the calls, that's for sure. My family does call occasionally and keep up with me as far as like say, hi, how are you? Actually, they don't say, how are you? They don't ever ask how I am or if I need anything. They just say hello. And they talk to me about what's going on in their life, which I think is exactly what you do to a mother. And I always ask and care about that. But Terry and I discuss what's going on with each other. And that's very different. It's much more personal. And I really do appreciate that because I don't have anybody else to talk to.
Terry,
To actually open up and say those things.
Sure. Terry, how has being a Phone Pals volunteer impacted your life?
Well, I'm a helper by nature, so I really like that, and I like to know if at the end of a conversation I've made Kathy's day a little brighter, and that's what it means to me. It makes me look forward to talking to her, and sometimes she's just bright to begin with, which is wonderful, and I don't know how Kathy feels about it, but I feel as though over the 6 years she's gotten brighter and brighter, and that makes me feel happy.
We do know from some previous conversations you've had with our producer, Terry, that you helped Kathy find a therapist, and that's something that was shared with
That's
us.
true.
Kathy, can you tell us a little bit about how that's impacted things for you, being able to seek the help of a therapist as well?
Well, Terry found that therapist for me. Terry and her friend they were walking the mall because that's what she does. Terry does a lot of things. She's a mover and shaker. And she found a booth that advertised certain kinds of help, and she never presses anything on me, but she says, I wonder if that would help you. Maybe you should give them a call, because I had been searching, and she was aware that there were no therapists in my area that either were taking new patients or would come to me, and definitely no one free. Well, I called these people, and they were wonderful. I can recommend them if anybody's listening. It happens to be Family Pride, and they are opening a new office in Painesville, but right now they're in Chardon, and they come to your home, and they do understand what PTSD and agoraphobia is. They don't mind coming to your home, not at all, and they're free, and they're wonderful, and they're young, and they know everything that's going on. So I can recommend them, but Terry found them for me.
Kathy, is there anything else you'd like to say about being involved with Foam Pals before we say goodbye to you here on The Sound of Ideas?
Do it.
Sage advice. All right. Kathy, thank you very much for that very poignant final thought there. We appreciate you calling in.
Oh, you're very welcome.
All right.
Bye, Kathy.
Dr. Lathia, I want to take a moment to ask you about some of the issues that Kathy was bringing up there about lack of access maybe to a mental professional. What would you like to say about that?
Well, that I have shared in the same struggles that Kathy mentioned for my patients as well at university hospitals. It is a challenge, unfortunately, for finding counselors that, I mean, to be honest, most counselors nowadays, especially since COVID, are only providing services virtually, online. And that can be challenging for somebody who is not very savvy at technology. There are still, in-office practices available, but it's becoming harder, more challenging to find that. So I try to keep a list of counseling services in the area that I can recommend to my patients. University hospitals, Cleveland Clinic, Metro Health, they all also have, of course, psychiatry and psychology departments, but I think the access can be still a challenge. And so I often do refer outside to other counseling services.
And let's talk about some of the significant health risks that are linked to chronic loneliness, Dr. Lathia. We've talked about it, in some situations it can actually lead to a fatality. But what should we be concerned about when it comes to the physical effect of chronic loneliness and isolation?
So being lonely, of course, increases risk that you're not going to have help for your chronic conditions. And so it can increase risk for exacerbations in chronic disease. It increases risk for greater susceptibility to things like heart attack and stroke, complications from hypertension and diabetes, and that then can increase risk for mortality. Also can lead to increased risk for frailty, for needing help with your daily activities, decreased appetite and weight loss, increased risk for falls.
Are there any particular physical manifestations that come from distress, like blurry vision or anything like that?
I would say the most common complaint that I hear is pain. And so older adults who have pain are at increased risk for feeling lonely. But I also think feeling lonely itself can be can lead to a physical discomfort and, of course, emotional discomfort. But I think that pain is a common complaint that you hear, as well as many other issues.
Okay. Well, I think we've well established here that loneliness and social isolation can be very dangerous for our mental and physical health and well-being. Ellie, I want to bring you into the conversation now. One way that you are fighting against that is with a knitting group. So can you tell us your age now and tell us about when the knitting group started?
Oh, okay. Well, I'm 82. Believe it or not, I don't believe it. But I started this knitting group, I think it's 14 years ago, actually. And I had a long career in journalism, and I left that and was working on a book. And I've been a knitter most of my life. My grandmother taught me to knit when I was about 10. And I thought, I want to start a knitting group, and I wanted to start the group in Cleveland. And, I had knit with friends and that sort of thing, but I wanted to do something in Cleveland. So this group, I established it at the Rice Branch Library, and I like the idea of a library because anybody can come. And you can come as long as you want. You can come and not like it and not come back. We have people in the group who were there at the very beginning. So, and some people just call it their family, their knitting family or their family. And the nice thing, there are a lot of older people in it, but it's also a mixed age group. We get sometimes people in their 20s, we get men. So it's black and white people. It's a very heterogeneous situation on many fronts. And we've also, because it's been around so long, we get some really, really good knitters. It used to be that I started it with another woman, and it would kill us in the beginning because nobody knew how to knit. So we had 22 people, and you have to run around teaching them. But now we have so many good knitters that they all can help each other. And that's the beauty of it, is that the group itself is a culture. And it's something that people look forward to coming to. And you don't have to become friends with anybody there. But you can if you want to. And there are connections that have been made, outside of the group. But the more important thing is just people come and what happens there. I remember early on there was an elderly woman, and I hardly knew her at all. And I said, Lenny, she was just sitting there and she wasn't knitting or she was a crocheter too. And I'm like, you're not knitting. Are you okay? Because she was just taking it all in. And she's like, yeah, I just like to sit here and just take in the atmosphere and the hum of what people are talking about. And it was just a happy place for her. And I think it's like that for a lot of people. So
we've got an email now from Maria. Maria is age 61 and says she spent a prior career in the field of aging for over 20 years and is still at it. Maria has referenced something we talked about earlier. You mentioned, Terry, RSVP. So
Yes.
that stands for Retired and Senior Volunteer Program, and it's now called Greater Cleveland Volunteers.
Yes.
So thank you for that, Maria.
Thank
we
you.
appreciate that. Maria is talking about intergenerational relationships and interactions, and says there's a lot of focus on young people in the future of Cleveland, and that the intergenerational exchange can do a lot to alleviate loneliness and support one another. So Ellie, I want to ask you about this because With your knitting group, you have been introduced to people in communities you may not have otherwise encountered. So can you tell us a little bit about the range of people that you've come into contact with the knitting group?
Well, it's being where the Rice Branch Library is. It's in a very impoverished area of Cleveland, and we've had people who have been homeless. They come to the knitting group, but they are sleeping in a park, women, and some of them have. But the person I work with, she's actually been a social worker. She's the same age as I am, but she can help. She helped actually both of these people find housing because she is really good on those resources. And then we've had some young people who, but also have, just like this one young woman who's, she is a college graduate, and she's gone on to college now in transition from while she's been in the program. But her whole family was homeless, and her mother was a drug addict, and she's just remarkable because she just sucks up every ounce of support there is in the group. And she one time said that we were asked to leave early, and when she went past the security guard, she said, like, well, I didn't get my full share from the mothers in the group. This was like all this mothering that was going to her. Mm-hmm. And then, the elderly people are just, I think the younger people love having the older people there, and there is interaction that way, and they get a lot from it as well. Because it's focused on a skill, and we've said from the very beginning, like, you don't have to be good at this. There's no competition here. There's no deadline here. And you want help, just ask for it. And so it has that quality. People may not get to know each other that well, but they certainly work together there. And it has the theme of helping and of interacting in that way. So, and then I think I mentioned we also have had men. We've had young men, and we had this one guy recently who's I think he's trying to be a minister, but he wanted to make this almost like the pattern was a poncho that other people have made, and he did make this thing, and I mean he had just started, and I got a text from him once at 3:00 in the morning, like, what is he going to do? How is he going to finish it? Because he had this deadline, and where he was doing a program, and a whole bunch of us went to it, and he was unbelievable because it was this white, it was almost like a robe, but it connected. And I'm like, wow, this is really something.
You got it done with the support of the group.
Well, 3 in the morning was
Whatever it takes.
whatever it
Everyone
takes. Loved him, though.
Oh. Denitra, let's bring you into the conversation now. Denitra Brown, Director of iConnect with the Greater Cleveland Neighborhood Centers Association. Tell us about iConnect. What is that all about? What's the mission?
iConnect is a program for older adults. We provide a number of social enrichment programs in order to help older adults that are experiencing loneliness and isolation. We do that through a number of ways. One of the ways is we have a strong emphasis on technology, and so we teach older adults how to use technology as a means to stay connected. But we also have a number of in-person programs where we actually go into apartment buildings and community centers, and we provide the fun program. So we do karaoke, line dance, we have crafts, anything. We basically let the participants tell us what would make them want to come out and experience these types of programs. And so we are, one of the ways that the Dr. Lathia said that with technology, we have a large Zoom program, and we provide programming pretty much round the clock because, a lot of the places they go to, the these senior centers, but they end at 3 o'clock. Well, loneliness doesn't just end there. You want to go home. And so a lot of people live alone. And so they want to still have those social connections. So we provide opportunity for them to get on Zoom, and we watch movies together. We, have some comedy things that we do, and just a number of things for them to be able to still be around people even when they're in their home alone.
Can you tell us about the age range of the population that you're serving?
Yes. So we say 55 and up. However, we do go into some apartment buildings that have populations that are a little bit younger. They may qualify because they have a disability, and so we don't, just say they don't qualify. So if we come into the building, anyone can participate. And we also have a number. We just started a great intergenerational program, and so we go into a 5-point community center. And we are partnering with Famicos Foundation. They have an apartment building, and our youth program, P4SS, they have we've been coming together now since probably March, and the kids and the older adults have developed a great relationship. It's really nice to see that develop and foster over time. One of the biggest things when we knew, like, okay, this is actually working, is when the older adults were planning for their Easter dinner, and they were asking the coordinators there at Notre Dame. They said, hey, we want to invite the kids. And they're like, oh, you want to invite your grandchildren? They said, no, we want the kids from the intergenerational program. Oh. So they were talking about them, and they came out, and they invited the families of the children. And, they had a really great dinner. They've also connected, and they've gone to, a lot of the kids do track, and we took them to a track meet. And so it's been a really great relationship. It's really nice to see it develop.
We have a question about relationships now with a call from Todd in Ward 1. Todd, welcome to the Sound of Ideas. Please go ahead.
Stephanie, Terry, Ellie or Eleanor, Amanda, and Demetria. So in my life experience, early on, the only lonely people I knew were shy people. I didn't know how to recognize it past that. So I have a question. As I got older, I noticed the people that I knew that were lonely, some of them had shame and self-absorption, and the same thing with people that weren't necessarily lonely, but there was isolation. They were isolated. They were driven by just that embarrassment of some things that they had gone through in life, but weren't necessarily that bad. So are there most common motivators for loneliness and self-absorption past shyness, like is shame and self-absorption a common motivator, and should those be addressed heavily first? Because these people lead frustrated. I've seen these people lead frustrated lives because of that.
Thank you for sharing the experience, Todd. Dr. Lathia, I'll ask you if you have a response there.
I think that's a really great question. Mental illness, for sure, is a risk factor for becoming lonely. And not just mental illness, which of course has can have a negative connotation associated with it, but prior experiences, any traumatic experiences, can lead to isolation in the future, and feelings of loneliness. And I just want to emphasize that anybody can suffer from loneliness, regardless of age or where they live. You can live with other people and still feel lonely. So it has to do a number of factors can contribute to it, including if you just have medical conditions that are frustrating and cause pain and cause distress, that can increase likelihood of feeling lonely.
Terry, please.
Before I retired, I don't look like it, but I am an introverted person who could easily not talk to anybody. So I said to my spouse, I'm so worried that when I retire, I'll isolate and I won't interact with people. So she wrote me a list of all these things I could do afterwards. Well, now she's probably sorry because now we do so many things. And I can't even picture being isolated, and I feel so bad when people are. One of the things that we do is with the Metropolitan Parks, we sing in nursing homes every week. So that's nice. So we just like are continuously doing things, and I try really hard when I see somebody isolated to
Bring them in.
help.
Sure, sure. To one of the points that was made, Dr. Lathia, that you had mentioned about being among many people but still potentially feeling lonely, we've got an email in from Dave who says, it's better to be alone than with bad company. A few close friends is better than 1,000 relatives. That's Dave's take on that, particular to the relatives. We wonder what your holidays are like, Dave. Just kidding. We're going to take a quick break now. When we come back, we'll continue the conversation about loneliness with people here in Northeast Ohio groups that are helping other adults stay socially engaged. This is The Sound of Ideas. I'm Stephanie Haney. We'll be right back. If you're just joining us here on The Sound of Ideas, welcome back. I'm Stephanie Haney. We have been talking about loneliness and isolation, particularly as it relates to older adults on today's episode of The Sound of Ideas. If you want to be a part of the conversation, you can call us at 866-578-0903. You can also send us an email at soi@ideastream.org or send us a message on Instagram at The Sound of Ideas. If you're just joining us, the guests we have with us today are Denitra Brown, the director of iConnect with the Greater Cleveland Neighborhood Centers Association. We have Dr. Amanda Lathia with us, the Division Chief of Geriatrics and Palliative Care at University Hospitals Cleveland Medical Center. Also, Ellie Bergholz, author of When Knitting Becomes Nurture. And we have Terry Vicks Norris with us, a volunteer with the Lake County Phone Pals. We have had some audience members email in, so we'll get to some of those questions now. Jim in Maslin, who, if you remember at the beginning of the show, we mentioned did inspire us, making sure that we did focus on social groups with older adults. Jim says, COVID, yes. Aging, yes. But let's not forget the alienation that has come along with the political climate where even some family members have stopped speaking to one another. Denitra, I want to ask you about this in terms of people having different backgrounds and all kinds of walks of life and how that works at iConnect, how people are able to come together.
Well, we actually are able to expand and service more people through our AmeriCorps program. And so our AmeriCorps program, they have a number of different people with variety of backgrounds. We have people that our youngest member was 18 that served in the AmeriCorps program that service in iConnect. And then we have somebody that is in their 70s. We have people that are retired. And so there's really a number of people. And then since beginning, working with bringing AmeriCorps members into the iConnect program in 2020 when I came on board, one of the participants that was, that found out about the iConnect program, she was lonely, she lived alone, and she has credited iConnect as saving her life during that time. And she has since become an AmeriCorps member. Wow. And she's, I think she's been doing it now for 3 years. Next year will be her 4th year. So she loves it. She's able to, connect with a variety of people. And that's one of the things that she likes the best, is being able to just connect with so many different people from so many different backgrounds.
Mm. We've got an email now in from Lucy in Seven Hills, and I'll direct this question to Terry and Ellie, who are with us representing the 70s and the 80s on the show today, and doing so fabulously, might I add. Lucy writes, I believe much of the loneliness experienced by older people is made much worse by multifactorial causes, a society that prizes youth, sexism and misogyny, and multiple losses of friends and family that only increase with time. Thanks for sharing that thought, Lucy. And Ellie, I'll ask you to weigh in on that. What do you think are factors that are making it tougher for people to connect in your age group?
Well, probably health issues can be a huge factor, because if you can't get around very well and you're not walking well, or you have memory loss, it just is, that just pulls you further away and away. So, but you had asked about the political climate.
Yes.
And that's an interesting question. We have one person that's very into elections and, is always passing out cards or whatever. But generally speaking, it's almost like an unwritten rule. People don't talk about politics. I don't know whether it's that they're not interested but if it comes up, the people have very strong views. I don't want to get into what they are, but they, they do not talk politics in the group, or even issues that come up. There might be something about health care and what's going to happen to the health care, or some issue that has been changed in recent months. But there's not a lot of political discussion at all, which I think is interesting. And I wondered about it for a long time because it's sort of always on my mind. But I think it's like, stop at the door with that. It just is, let's make this peaceful and not get into, the group is a very binding thing. It has, I don't know exactly how it developed, but it did. And I think they just don't want stuff that is going to be divisive.
Terry, what do you think about that in your age group? Do you think that politics is something that is dividing and making it harder to people to connect? And what about any of those other issues that were mentioned?
Well, one of my best friends is totally one way, and one of my best friends is totally the other way. So, and I won't say which way is which, and I won't say what I am, but I'm just saying that we have an understanding that unless I'm with the person who agrees with me, we don't go there. I said, we can't be friends if we're going to talk about that, because then it leads to arguments. So I said, let's just talk about anything else. And then, of course, sometimes you fall into a trap by accident talking about healthcare or something, and then all of a sudden you're there. So then I back up and nope, we're not going to do that. So that's how I do it. And then I find I can still have my relationships, because I think it's absurd to not talk to half the people in the country because they feel differently than you. So I make sure that I find the best I can in each person, and we enjoy what we have that we can enjoy together.
Do you think that that is some understanding that comes with having more life experience, of the fact that you maybe aren't going to change someone's mind, and maybe that's why these conversations are sort of just respectfully declined? Does that have anything to do with it?
For myself, yes. I can't speak for anybody else, because some people, I think, if they're 99, they'll argue to the death about it, So, but and a lot of people won't. So I think it's individual more than anything. Okay. How much you value a relationship and are willing to lose it over politics.
Sure. We have a couple calls now. We've got Ruthie in Mansfield. Welcome to the Sound of Ideas, Ruthie. Please go ahead.
Yeah, good morning. I have been listening to your programs. I listen to most of them, and they're very good. But I'm curious as to why nobody has mentioned a church family. We have a lot of older people, and I'm 79 myself, but we have a lot of people who have lost their husbands. We have, social events, and very supportive, helping give rides to church meetings and such. And I'm just curious why that nobody has mentioned having a church family. And, I know that's probably going out of style, but it's been a real important thing in our church family community.
Thank you for sharing that, Ruthie. Dr. Lathia, do you have some comments you'd like to share about that?
No, I'm really glad that you brought up that point. I think we just haven't had an opportunity to talk about the opportunities available for people to combat loneliness. Church and other religious communities is an excellent avenue for having a community. And it really is about that. It's about having connection, and it could be through any activity, whether it's knitting or, karaoke and line dancing, a church environment, book clubs, And I think one of the challenges, there's many challenges, especially for older individuals, is not having transportation. A number of older adults don't drive, or not being able to access social media, as we discussed already. Having mobility issues and not being able to get out of the house. So and also I think just not being aware of what's available. So I do want to make a plug for Benjamin Rose Institute on Aging, which offers a number of excellent programs, including a senior companion program for adults, older adults, where they pair individuals with adult volunteers that are 55 and older. So it's kind of similar to your program, Terry, which can be very helpful. And then they have a number of additional resources as well that help. There's behavioral health services, and the We Care Because You Do program for older adults, which is a telephone-based care coaching program. And there's a number of senior centers that offer activities. So I really do encourage people to look online, have their family members look online for resources that are available. And there's also transportation options as well for those who don't drive. There's, of course, Lyft and Uber. Uber has a program called GoGo Grandparent for older adults who don't have a smartphone. And then there's Senior Transportation Connection and other services such as that.
We have a call now, speaking on the topic of resources. We've got a call now from James in Stark County. James, welcome to the Sound of Ideas. Go ahead.
Well, hi there. Certainly anything that splits families probably had a greater effect on alienation than COVID did. I wanted to talk with the comment of the last lady where she brought up public resources that are common. Public libraries are pretty darn common, and some of the people who've been involved with public libraries probably know that they've become as much event centers as they have been centers for disseminating books, certainly, which are fading a little bit, but DVDs and other things. And public libraries, because they've become event centers, much as some museums and things have too, we started a vinyl club down here in Stark County, which has been really successful. I went to a library director and said, why don't we try this? And it 4 people the first time, and 10 and 15 and 25 and 32 and 41. And so, that was numbers. And it's been all ages and all backgrounds and things, and it's probably evenly split between males and females of various ages. And of course, vinyl records, for some reason, have come back recently. And so I just don't want to neglect the fact that the public libraries have lots of these kinds of things that are not specific to a particular organization or something like that, much
Sure.
more of a public facility. Thank you.
Thanks so much, James. We appreciate it. Denitra, as we wrap things up here, what would you say to someone who's looking for community but not necessarily sure where to start?
I would say go out to look at your the senior centers in your neighborhood. Libraries, they have resources. You can certainly call 211, first call for help, see what's out there for that. There are a number of different things. Please come on our website, look and see what Zoom programs we have, and connect that way. So there are a number of different options that you can do to reach out and see what's out there.
All right. I want to thank our panel for being with us today for this conversation. Denitra Brown, iConnect Director with Greater Cleveland Neighborhood Centers Association. Thank you, Denitra.
Thank you.
Dr. Amanda Lathia, Division Chief with Geriatrics and Palliative Care at University Hospitals Cleveland Medical Center. Thank you.
Thank you.
Ellie Bergholz, author of When Knitting Becomes Nurture. Thank you, Ellie. And Terry Vakes Norris, volunteer with Lake County Phone Pals. Thank you so much, Terry. That'll wrap up the show for today. If you missed any part of today's show, you can hear a rebroadcast tonight at 9 on 89.7 WKSU. You can also find every episode of The Sound of Ideas wherever you get your podcasts and on the IdeaStream Public Media YouTube page. To get the last word on today's topics, you can email us at soi@ideastream.org. You can also find us on Instagram. We're at The Sound of Ideas. On Thursday's show last week, we looked at Avery's Law, dealing with dogs that have bitten or attacked people or other animals. Roger wrote in to address the dog warden's interpretation that a specific dog bite scenario would likely amount to being an unprovoked attack from that dog. Roger did not agree. Roger wrote, "On the topic of dog bites, the issue is usually the people involved who don't know how to behave around dogs. Owners need to be responsible on who the dog is allowed to interact with, and the people who interact with dogs need to understand how to behave." Roger, thank you very much for weighing in. You can find that full episode wherever you get your podcasts and on our YouTube page. Tomorrow on The Sound of Ideas, we'll start with a conversation about allegations of Medicaid fraud in Ohio. Then we'll bring you a new installment of The Menu in partnership with Cleveland Magazine. This week, we're looking at the flats in Cleveland. We'll talk with the chef of the recently reimagined Shooters and other business leaders in the neighborhood. I'm Stephanie Haney. Thank you very much for keeping the conversation going here on The Sound of Ideas. We'll see you back here tomorrow.